This is a talk on cancer risk reduction. Interestingly and importantly, when you reduce your risk of cancer by following lifestyle and nutritional recommendations, you also reduce your risk of many chronic illnesses. Dr. David Katz is a physician and professor of public health at Yale, and he says there is nutrition in lifestyle, and then there is everything else in medicine. He goes on to say that there's immense power in our forks, in our feet, and in our fingers. This is the EPIC study, published in the Archives of Internal Medicine, a very important medical journal in 2009. And it asked the patients to do 4 things: to eat vegetables, to move daily, and maintain a healthy weight, and don't smoke. If they did these 4 lifestyle and nutritional recommendations, they had a 93% decreased risk of diabetes, an 81% decreased risk of myocardial infarction, 50% decreased risk of stroke, and a 36% decreased risk of cancer. Wow, there is immense power in prevention. The American Cancer Society has similar recommendations. They ask you to maintain a healthy body weight throughout adulthood. In fact, they'd like you to be as lean as possible without being underweight. They want you to be physical, at least 150 minutes weekly. And this could be walking, gardening, playing some sort of sport, or just housework. Just stay busy. And to eat a healthy and nutritional diet, a nutrient-dense and colorful diet, one we'll talk about much more in the next several minutes. They recommend that you limit alcohol. For women, less than 1 drink per day, and for men, less than 2 drinks per day. But for many hormone-related cancers like postmenopausal breast cancer, it's probably best for women to drink much less than 1 drink per day. This is a wonderful online review that's available for free. If you Google the American Cancer Society Review 2012, you will find a 30-page document that's quite readable and very, very informing. The World Cancer Research Fund recommends 10 prevention recommendations. Maintain a healthy weight, move more, eat well, enjoy a plant-based diet, avoid processed meats, cut down on your alcohol, limit your salt, breastfeed if you can. Don't expect vitamins and minerals and other supplements to prevent cancer. And if you have cancer or have been diagnosed with cancer, follow all of the same recommendations. Although exercise is important, I'm going to present only this one very, very important study to verify its importance in regards to reducing the risk of cancer. This is from the Journal of the American Medical Association, May 2016. They followed 1.4 million people in the US and Europe and did so for 11 years. They found that walking 150 minutes weekly reduced the risk of all cancers by 7%, and liver, lung, breast, all by more than 10%. There is much medicine in the food we eat. We'll talk about these specifically as we go forward. There are 3 macronutrients: fats, carbohydrates, and protein. Let's start with fats. The 2015 U.S. Dietary Guidelines, the recommendations published in JAMA last year, said that we should have a lifting of the ban on total dietary fat. They go on to say that it is warranted to move away from total fat reduction to healthy food choices, including those high in healthy fats. The USDA is telling us that we should increase the healthy fats in our diets because many studies have begun to provide significant information that dietary fats are important to our overall health. So, we know now that fats are no longer a 4-letter word. This very important study, the New England Journal of Medicine, it's called the PREDIMED study. And what they did is they took a large group of individuals who were already eating the Mediterranean diet. The Mediterranean diet, of course, is one of the healthiest diets on the planet. Half of the group they asked to add an additional 4 tablespoons of olive oil daily, or an additional 30 grams of nuts. And they found that when they did this, there was a 30% reduction in overall cardiovascular events. 30%. And this was such a powerful result that they had to stop the study early. These additional healthy fats lowered the risk of cardiovascular disease. Well, this same study, the PREDIMED study, looked at olive oil use in breast cancer. And they found in this same study, published now in JAMA 2016, that there's a 68% decreased risk of invasive breast cancer in individuals using high-fat Mediterranean diet. An emphasis here was on extra olive oil. A second study published in the Annals of Oncology 2016 showed that if women were eating this additional olive oil or nuts, that they also had a decreased risk of recurrence should they have breast cancer. There was a significant decreased risk of recurrence of breast cancer in women that were eating this way. For men, this important study in the British Journal of Oncology 2016 showed that eating five servings of nuts weekly, that is 5 days weekly, they followed these 47,000 men for 26 years and found that it decreased the risk of dying from prostate cancer by 34%. Nuts are known to be high in vitamins, minerals, and phytochemicals, and certainly high in great fats. These same nuts also reduce the risk of heart disease and stroke. This is a summary on the current recommendations on fat intake, and this was put forward by Dr. Walter Willett of Harvard, the most respected nutritional scientist in the country, probably the most respected nutritional scientist in the whole world. He said that trans fats were definitely bad, increased our risk of heart disease and other chronic illnesses, and that things like refined starch and sugar, and we'll define this a bit more, also increase our risk of cardiovascular disease. And saturated fats that may come from meat or coconut oil, and just general carbohydrates that we might get from sweet fruits, for example, are neutral. They neither increase or decrease our risk of cardiovascular disease. However, whole grains, beans, and lentils, and olive oil and nuts and oils from nuts absolutely decrease our risk of heart disease and decrease our risk of cancer. So this is a slide and a graph that tells us about the fat intake related to obesity over the last 50 years. In 1960, the average American had about 43% of their daily calories from fat. Now, it's less than 35%. Whereas in 1960, there was only 13% obesity. There is greater than 30% obesity in our country. In fact, 2 out of 3 Americans are either overweight or obese. The American Cancer Society tells us that being overweight or obese is clearly linked with increased risk of several types of cancer: breast, colon and rectum, endometrial, esophageal, kidney, and pancreas. When we become obese, we have increasing activity and an increased size of our fat cells. Actually, we may have even increased fat cells. And when you have increased fat cells, they increase our risk of cancer by liberating or producing these small chemicals called cytokines. Cytokines increase inflammation throughout our body, and with increased inflammation, we have increased cardiovascular disease, increased diabetes, and increased cancer. We also know that when a person becomes obese, their insulin is likely up, as is their insulin-like growth factor, an important growth factor that promotes the growth of cancer cells. And last, we know that this obesity, these fat cells actually increase the generation of estrogen in the body. And this is important for women related to breast cancer, but also important to men in that this increased estrogen may increase the risk of prostate cancer. So we've learned that fats don't make us fat. It's the processed carbohydrates. Foods like these, donuts and sodas and pizzas, sweetened drinks and potatoes, that most of the time we make the choices that are healthiest for us. We want to choose foods that we love and that love us back. This is Dr. David Ludwig, the author of this recent book. He's a professor at Harvard University, a researcher on obesity, and actually runs a large obesity clinic. And what he's found through his research and through his clinical programs, that if people eat a lower glycemic diet, one that is high in whole foods and very low in processed foods and in foods with added sugar, that their insulin levels come down. And when their insulin levels come down, it allows them to burn excess body weight and to decrease their hunger. This is Dr. Walter Willett, professor at Harvard and a distinguished educator and scientist in the field of nutrition. He recently said, white bread, white rice, white pasta, potatoes, sodas, and sweets are 30 to 40% of the calories in most diets, and there is simply nothing good about them. They lead only to harm, weight gain, diabetes, coronary heart disease, and cancer. Processed carbs, the ones on the left, the pasta, the bagel, the M&Ms, the Coca-Cola, and even the orange juice, liberate sugar very quickly into our bloodstream, driving things like obesity, triglycerides, cholesterol, and inflammation. Whereas these wonderful unprocessed carbohydrates on the right, the lentils and sweet potatoes and kale and the whole grain oats, burn very slowly metabolically, and they liberate their sugars into the system over hours. So they don't spike our blood sugar and therefore don't spike our insulin and keep us satisfied much, much longer. Dr. Willett has also said, choose a wide variety of vegetables and fruits. Don't include white potatoes as vegetables. Go easy on fruits that are higher in carbohydrate, such as oranges, bananas, and apricots, cherries, and grapes, and avoid fruit juices. They're way too glycemic. It's important for us all to read labels and look for added sugar. This is a great example. This is a peanut butter that can be picked off the shelf probably at any grocery store. Notice that the first ingredient is peanuts, but the second ingredient is sugar. And then there are added things like fully hydrogenated vegetable oils, mono and diglycerides, etc. And the choice on the right includes only peanuts and salt, a much better choice. Now, if you were to go down almost any aisle in the grocery store, you can find, typically right next to each other, a good selection or a selection that's full of extra hydrogenated oils or added sugars. Marinara sauces are very common to include this. So if you pick up maybe a standard one, you'll find that it'll have tomatoes, but it'll have some sugars in it, some soybean oil, other oils that may not be that beneficial. But you can pick up another variety that has tomatoes and olive oils and garlic and salt and pepper and other wonderful spices that are really nutritious for you. Again, a food that you can love that will love you back. We have to be careful and we have to be a sleuth for added sugars. These days, there are at least 56 different names for added sugars in our foods, from things like butter syrup to fructose to carob syrup to diastase, the yellow sugar, the rice syrup, to honey, to dextran, to icing sugar, to ethyl maltol. Now, many of these kind of sound like sugar, but some of them don't, like, for example, dextran. This is an example of a high glycemic food, one that most people would think would be heart healthy. This is made from whole grain oats, but it's whole grain oats that are ground into a powder and then formed into an O. And when you eat these and they hit your stomach and the top of your small intestine, they're almost immediately absorbed. And this kind of carbohydrate is really just a long chain of sugar molecules and will boost your sugar in your bloodstream very, very quickly. Whereas if you were to choose oats in their steel cut form, they're unprocessed and lower glycemic. They won't quickly be absorbed in your system, and therefore they won't bump your blood sugar or bump your insulin level. A graph that illustrates this. Foods on the bottom, the cereals and breads and potatoes and sweets, drive glucose. Insulin then follows to control the glucose level in our blood. And soon thereafter, actually, the glucose falls within a couple of hours, even below the baseline that you were at before you started eating. The insulin drives it down here, and within a couple of hours, we're quite hungry again. Importantly, that insulin increases hunger. We know that, as we saw 2 hours later when our blood sugar is low, but also increases the insulin-like growth factor 1, which is a promoter of cancer in our body. And when you increase insulin, you increase inflammation. Better choice are these low glycemic foods. Again, wonderful and delicious foods. Vegetables, fruits, beans, nuts, meats, and fish. These don't drive the glucose very high. The insulin can stay low, and many of the metabolic concerns are not seen. So what to drink? Well, mostly water. We really don't need to have beverages that contain added calories and sugar. Water, green tea, and coffee are all excellent choices. Green tea is amazing. It's low in caffeine, it's antioxidant rich, reduces cancer risk, promotes healthy bones, interestingly, and supports liver detoxification. Another favorite drink of mine is coffee. It's amazing too. It's the highest source of antioxidants and polyphenols in the Western diet. People that drink coffee frequently, up to 5 cups a day, is actually found to be healthy as long as you're not overdoing the caffeine and you're sleeping well and not having agitation or palpitations or those kind of concerns. Coffee can decrease the risk of Parkinson's, Alzheimer's, and it certainly improves liver function. When you have coffee, skip the sweeteners and artificial creamers and maybe add some whole fat dairy to make it smooth for you if you like it that way. And so what not to drink? Clearly, you want to avoid the sugar-sweetened beverages. Things like a typical 12-ounce soda would have 10 or so teaspoons of sugar, about 150 calories from added sugar. Much more than any one of us should have in any one day. The American Heart Association recommends that we have no more than 50 grams of added sugar daily. Now, even up on the left where we see the juice, although we don't add sugar to juice, there are plenty of natural sugars in juices. So we need to be careful about those, and as Dr. Walter Willett said, pretty much avoid them. This paper from PLOS One in 2014 showed how sugar-sweetened beverages can increase the risk of cancer. In fact, they say sugar-sweetened beverages intake was associated with a significantly increased the risk of cancer and mortality. So what does a low glycemic diet look like? Well, here's the real food pyramid with plenty of colorful and delicious vegetables and fruits at the bottom, meats and fish and eggs, berries and coconut and other fruits at the top, with nuts and beans and cheese at the very top. Angiogenesis is the process of building new blood vessels in the body, and cancer growth is very much dependent on abnormal angiogenesis. According to this 2012 paper in Nature Reviews Clinical Oncology by Dr. William Lee, all of these wonderful fruits and vegetables decrease the risk of angiogenesis and are anti-angiogenic, limiting then cancer growth and spread. Things like green tea and apples and Asian mushrooms and garlic and tomato and wonderfully dark chocolate too. Protein. This is the third macronutrient. We've talked about fats and carbohydrates, and now protein is so important for older adults because of a condition called sarcopenia. Sarcopenia is muscle loss, and sometimes very accelerated muscle loss as we get older. You can see on the picture of a cross-section of a thigh muscle on the far right that most of that leg is now fat, whereas the younger person at 25, most of the leg, the cross-section, was of muscle. In the typical Western diet, people have a little bit of protein for breakfast, maybe a little bit more at lunch with a salad and some chicken, and often a large piece of protein, maybe 50, 60, or 70 grams at dinner. The problem with this is we can only assimilate about 30 grams per meal. So the morning meals we weren't getting enough, and the evening meal we were getting too much, and some of this protein then will be turned to sugar if it cannot be used through a process in the liver called gluconeogenesis, where new glucose is made from protein. The way to maximize your muscle gains, or really to promote stability and not to lose so much muscle as you get older, according to Douglas Patton Jones and other researchers across the country, you want to spread your protein out. He noted, he is a professor at Texas and also a researcher at NASA, and he did a couple of experiments. One, he put astronauts to bed for 30 days, and he fed them the typical American way, that is, they have the largest protein dinner, and he found that they lost a significant amount of muscle as he expected over those 30 days. Surprisingly though, if he spread the protein out, so they had the same amount of protein, but they had some with each meal, about 30 grams with each meal, they lost much less muscle. And importantly, they followed this study also into the hospital, and they took care of patients who were admitted with either pneumonia or other sorts of infections. And they found if they gave them 30 grams of protein with each meal, that they recovered quicker, that they lost less muscle, that they had better infection fighting capabilities. So there's 33% more muscle building with evenly distributed protein throughout the day. This is a picture of multiple different protein sources, about 30 grams, from the beans at the bottom to the chicken and fish and eggs to soybeans and nuts and even yogurt at the bottom right. Lots of different ways you can get protein with each meal. If you're trying to optimize your exercise and you like to go out and exercise in the morning, cereal and OJ in the morning isn't enough protein to really maximize your muscle development and maintenance as you get older. Now, the American Cancer Society tells us that we need to be careful in choosing meats, that grilled and processed meats are potentially dangerous. Grilled meats, because the charring on meat that may come from the broiler or may come from the barbecue pit, that grilling has heterocyclic amines, which are chemicals that can break DNA and increase the risk of cancer. On our processed foods like the hot dogs and the cold cuts and so forth, those foods often are high in nitrates. Nitrates can be changed in your gut to a group of compounds called nitrosamines, and nitrosamines also increase the risk of cancer. So we should eat these foods only occasionally. Fish are wonderful, and actually these are some of my favorite fish, sockeye salmon. The American Heart Association recommends that we have at least two servings of fatty fish every week. They tell us that this will lower our risk because of the omega-3 fats in these fatty fish of heart disease, but will also lower our risk of inflammation. When we lower the risk of inflammation, we decrease the risk of cancer. In regards to fish safety, the ones on the left, the salmon, the whitefish, sardines, are very low in mercury. All of these are suitable fish to eat frequently. The ones on the right are high in mercury. They eat high on the food chain. Things like swordfish and tilefish and marlin and tuna. Let me summarize the basics of a really healthy diet that you can love and again will love you back. The foundation of that diet is our vegetables, many different colorful vegetables, beans, lentils, and whole grains, fruits of all kinds, less if you're diabetic, meats, fish, poultry, and eggs. And if you're going to have dairy, it's just fine to have whole fat dairy. It's probably most beneficial that way. Nuts of all kinds, and of course olive oil. Sweets, maybe a little, and then a big dollop of love. And all of this is a way to have a very nutrient-dense, colorful, and delicious diet that promotes your health and decreases your risk of developing cancer. Michael Pollan, who many of you know, said it this way: eat food, not too much, mostly plants. I want to say a little bit about soy in breast cancer. This was a study, the American Journal of Nutrition, by Dr. Nukata. Soy food intake in breast cancer survival. They found that eating soy when a woman already had breast cancer, there was a statistically significant reduced risk of occurrence. So for a long time we thought that soy may be dangerous for women with breast cancer because it has some estrogenic effects. But soy actually is a SERM, and that's a selective estrogen receptor modulator. So it binds, but not nearly as strongly as estrogen. So in a way, it may end up blocking estrogen effect in the body. A second study was in the journal Breast Cancer Research and Treatment, 2009. They looked at soy isoflavones. This was done at Kaiser Permanente. And they found that this diet may reduce the risk of cancer recurrence in women actually receiving tamoxifen therapy, and moreover appears not to interfere with tamoxifen effectiveness. This is a study about vitamin supplementation use during breast cancer treatment. 4,800 women, 4 years of follow-up, the Shanghai, China breast cancer study. Vitamin U shortly after breast cancer diagnosis was associated with a reduced risk of mortality and recurrence. Women who used antioxidants like vitamin E, vitamin C, multivitamins had an 18% reduced mortality risk and a 22% reduced risk of recurrence. This is another important study on multivitamin use in women with breast cancer. In the journal Breast Cancer Research and Treatment 2013, their conclusion, after following 7,700 women for 7 years, was that breast cancer mortality was 30% lower in the multivitamin users as compared to non-users. This association was highly robust and persisted after multiple adjustments for potential confounding variables. This is the very interesting study, JAMA Internal Medicine. This is the physician's health study. And what they found is that adult male physicians, that's who they studied here, who took a multivitamin daily had an 8% reduced risk of overall cancer. And I think you remember back to the very beginning when I talked about exercise, walking 150 minutes weekly, how that could reduce the risk of all cancers by 7.5%. This is very comparable to that. Again, we're going to need more studies, and this was a very selective study, and there was men, typically white men, 14,000 followed over 11 years. This needs to be more generalized, but we're starting to get more information about how multivitamins may help. A summary about multivitamins. In some studies, there was a study called the CARROT trial and the ATBC trial that was done in the 1990s found that antioxidants like vitamin E and beta-carotene actually increase the risk of lung cancer in smokers. All of the negative reports on the use of multivitamins were in people that were using vitamin E in the alpha tocopherol form and beta-carotene and iron. Vitamin E comes naturally in 8 forms, 4 tocotrienols and 4 tocopherols. In a typical inexpensive multivitamin, only alpha tocopherol is there, and it's there in too high doses, and it decreases the body's ability to absorb all of these other important vitamin E's. We know that we want to avoid beta-carotene because of those studies as noted above, particularly the CARROT trial where we saw that adding beta-carotene increased the risk of lung cancer in smokers. But other carotenoids like lutein and lycopene are just fine. I think you want to avoid folic acid and instead use methylfolate, which is a more natural form of folic acid. Folic acid, that's it put in our multivitamin, is a type of vitamin B9 that was formed in the lab in the 1940s because it was stable on the shelf. And then we've noted that folic acid has been added to our food since the 1990s because folic acid decreases the risk of neural tube defects in children and probably neuroblastoma as well. However, in people that have early cancers in their colon in particular, folic acid can increase the growth of those tumors. So I recommend avoiding standard inexpensive folic acid. And unless you're a menstruating woman, you should make sure on your multivitamin there is no iron. It's always a good idea to talk to your doctor about making the best decision here. This is a multivitamin that is particularly designed for cancer survivors. And I just want to point out a couple things on this multivitamin. Number one, it doesn't have beta-carotene. It has standard vitamin A and not very high doses, a reasonable dose. Number two, it doesn't have iron. It also does not have copper. And it has the full spectrum vitamin E, the full spectrum vitamin E, so you can get all of the benefits without any detractions from the vitamin E. So this is something called the Pro-Thrivers multivitamin. This looks at the role of vitamin D in reducing cancer risk. This is Nature Reviews, a very important journal of medicine in 2014. They said that clinical studies strongly suggest that vitamin D deficiency increases the risk of developing cancer. Very recently, the Organization of Public Health Physicians in the country recommended that every adult get their vitamin D level checked. I agree with that. Let's move on to bone health. Obviously, something very important for women and men, and particularly women with cancer. It's important to get your vitamin D level tested. Optimal levels are in the 40 to 50 range. Calcium, 250 milligrams twice daily is all that's needed for most individuals. If you eat a healthy diet, you're very likely to get about 700 milligrams or more of calcium in your diet without even having any dairy, cheese, or milk or anything like that. Because things like nuts, almonds, beans, broccoli, other green vegetables all have significant amounts of calcium. You don't want to overdo calcium. You want to get a total of about 1,000 to 1,200 daily. So a supplement of 250 milligrams twice daily is plenty. Interestingly, recent studies show that prunes affect bone development in a good way, even in adults, not necessarily just in children. So what it does is it enhances osteoblastic activity. Osteoblastic activity are the cells that actually build bones. Wonderful. So prunes 5 to 10 a day can increase natural bone building. Interestingly, almonds decrease the breakdown of bone through osteoclast, another type of cell that actually breaks down bone. So almonds decrease osteoclastic activity, therefore decreasing bone breakdown. Prunes increase osteoblastic activity. So now we got two wonderful foods that work on either side of the equation to help better bone health. And then yoga, 12 minutes daily, has been shown to increase bone mineral density. I'll refer you to this wonderful book by Dr. Lauren Fishman, a rehab physician in Manhattan, that has shown in over 200 women that 12 minutes of yoga, 10 different postures on a daily basis, can increase bone mineral density. This is a wonderful paper recently in the New England Journal, October 2015, and this was for chemoprevention. And we're not using chemotherapy, we're using a vitamin. The vitamin nicotinamide, which is B3 in a special form, given to individuals twice a day, 500 milligrams twice a day, decreased the occurrence of skin cancer in this large population of individuals in Australia in just 1 year by 23%. We know that the sun causes skin damage and potentially cancer of the skin cells by breaking and injuring the DNA in the cells. We know that nicotinamide increases the energy in the cell and then can increase function of DNA polymerases and repair enzymes that can repair the damage that the sun has done. Now, I don't recommend taking nicotinamide and then getting too much sun. I recommend taking the nicotinamide for folks who may have had this non-melanoma type skin cancers, things like squamous cell and basal cell skin cancers, to help reduce the risk of further occurrence of them. I also recommend modest use of sunscreens and a lot of cover up, using hats and long sleeves if you're going to be exposed for long periods of time. Now, 20 to 30 minutes on a daily basis is good to be exposed to the sun. It's good for your skin, it's good for vitamin D, and good for your general health. This is one of the most important studies, I think, in oncology in the last year. This was published in JAMA Oncology, April 2016. Prolonged nightly fasting and breast cancer prognosis. 2,400 women were followed for 7 years. And they were asked to follow this diet in which they fasted overnight for 13 hours, 5 days weekly. Okay, so what that meant is they had an 11-hour window to eat from. So if they had their first meal at 8 a.m., their last meal would be before 7 p.m., and then they fasted overnight. So these women reported that it was quite doable. They tended to lose a couple of pounds, but they didn't lose a lot of weight. And they found that it was very manageable, particularly that it was only 5 days weekly. The benefits were just outstanding. There was a 36% decreased recurrence of breast cancer in these women who followed this 5-day-a-week nightly fasting. Wonderful. There was a 22% decreased risk of death from any cause. And interestingly, this fasting, 13 hours nightly, lowered their cholesterol, lowered their average glucose as measured by hemoglobin A1C, lowered inflammation as measured by CRP. They had less reflux, GERD, and they reported better sleep. Wonderful. There is immense power in food as medicine. These are some power foods. Add a serving of each one of these daily. A serving of greens, berries, nuts, and olive oil, and you will decrease your risk significantly of cardiovascular disease and cancer, as the studies have shown us. Let me end by giving you an example of a wonderful smoothie that I like. This is a smoothie for two, and it has several different things that will lower your risk and also be delicious as well. Add some greens, spinach, kale, or chard. Add 1 apple. Add 1 cup of blueberries. Add 1/2 cup of Greek yogurt. Add some collagen powder, 1 scoop, about 10 grams. Add 3 cups of unsweetened almond milk, or about 25 almonds. Add avocado, ginger or turmeric, or both, 1 inch, and some cinnamon, and finally some olive oil. Mix it all up, and voila, you have a beautiful, tasty, delicious, healthy smoothie for both you and your significant other. This is that recipe again. And let me end by summarizing. The American Cancer Society recommends to decrease your risk of cancer, to maintain a healthy body weight throughout adulthood, be as lean as possible. Be physical, 150 minutes weekly. Gardening, housework, bowling, just keep moving. Eat a healthy, nutrient-dense diet, colorful, and limit the alcohol. Food is medicine. Enjoy real food daily and improve your health.